Good morning, ma'am. Good morning, classmates. Today, our group one, is actually tasked to discuss to you guys about how professionalism benefits and contributes to a healthy work environment for healthcare professionals, patients, or their families, and the organization. So, I myself, together with Genevieve, so we will first discuss to you about the characteristics of a healthy work environment for healthcare professionals, patients, or families and volunteers. And Kinjal, Jagdeep, and Mohammed will also discuss to you about the benefits of professional collaboration for healthcare professionals, patients, families, volunteers, an organization, and community partners. So let's start. So, looking at here, the question is, what is a healthy workplace? A healthy workplace, according to WHO, or the World Health Organization, it is one where workers and managers collude to constantly enhance the health, safety, and well being of all workers. And by doing this, it maintains the productivity of the organization. So, actually, research shows that a healthy work environment can lead to more engaged nurses. It decreases the burnout, lower turnover, and better patient care. So if we create a healthy work environment, it will enable us nurses or any healthcare professionals to provide the highest standard of compassionate patient care while being fulfilled at work. So as you can see right here, um, actually, an effective workplace health and well being program simultaneously addresses individual, environmental, and organizational factors affecting workers' well being. So, take a look at this figure, figure number one. So, the white one, it's the center. It says healthy workplace. Surrounding it is actually the healthy people with a healthy vision and in a healthy places. So let's start with the healthy people. This is actually the individual factors. It actually focuses on individual needs like improving access to healthcare services and information, as well as building the knowledge and skills of workers to adapt healthy lifestyle. Like for example, because of the pandemic that we are having right now, so the government actually offers free COVID-19 vaccinations to all the people. So that will make us people healthy. The second one is the healthy places. It's actually the environmental factors. So it will provide a physical work environment that supports healthy choices and offers resources to actively encourage healthy behavior. For example, like nurses who wants to ride a bike going to work, so maybe the hospital can provide bike racks or shower facilities since most of us nurses, well, it's kind of messy job though. We deal with bloods and other fluids, so might as well they have like shower facilities for us. Now, next is the healthy vision. So, it's actually the organizational factors. Okay? So, active commitment of management and business practices and policies support and encourage healthy behavior, like, for instance, flexible of work or smoke free policies, perhaps. So you see, an effective workplace health and well-being programs can have positive impact on workers' productivity and performance, as well as the health and well-being of employees, families, and communities. Right, looking at the next slide. All right. So a healthy working atmosphere is one in which a lack of harmful situations can cause injury and illness and abundance of health promoting ones. So that's according to World Health Organization. All right. So nurses actually have the potential to lead the way in improving health and healthcare for all. But in order to realize that potential, they must operate in an environment that is safe, empowering, and satisfying. Next is a healthy environment is a place of physical, mental, and social well-being supporting optimal health and safety. That's according to the WHO. That's the meaning of a health work environment. So it isn't just about making sure healthcare settings are free from potential threats to a practitioner's physical welfare. So let's say, given we spend one third of our lives at work, the working environment can have a significant impact on our health and well being. So the next topic will be discussed by my teammate.
Good morning, ma'am. Good morning, classmates. My name is Jenevi. I'm going to present creating and sustaining a healthy work environment. First, both employers and employees must obey the applicable legislation. Examples of these are occupational health and safety. This promotes safe and healthy working environment. Ontario Human Rights Code. Every person has a right to equal treatment. Employment Standards Act is the law that sets minimum standards for workplace. Second, requires both employers and employees to learn, engage in, and adhere to organizational and safety policies. With this, both employer and employees know or understand the safety policies in the workplace. Third, encourage to have open and sincere communication. With this, they can resolve any conflicts in the working environment, respecting each other, free from blaming or shaming. Fourth, promote mutual attachment to a common vision, mission, set of values, and strategic priorities. In the healthy work environment, both employer and employees choose to achieve strategic goals. Example, assess current organizational culture, review the strategic business plan. Fifth, encourage employee wellness, strength, work and family balance, and teamwork. Employees need to balance personal life and career work and need to apply teamwork all the time. Teamwork, collaborative effort of a group to achieve common goal. This picture shows a healthy work environment. There are examples of healthy nursing work environment. According to American Association of Critical Care Nurse, healthy work environment standards. First is the skilled communication, able to communicate well with the people. Skilled communication is promoting open and effective conversation among team members, optimize patient outcomes, encourage essential collaboration. Second is the true collaboration. You can able to cooperate to other healthcare provider. A team that works together succeeds together. Example, if a pregnant patient shows signs of a heart issue, the cardiac surgery team will be called to work together with those in the maternity ward. Third is the effective decision making. Decisions need to be capable of being implemented, whether on a personal or organizational level. Example, deciding what to do next, deciding what to wear. Fourth is the appropriate staffing. Is a comprehensive, dynamic process that ensures patients receive optimal level of care. Example, is the ratio and proportion of a nurse. One nurse serves 4 patients. You do not need too much workload. Fifth is the meaningful recognition. Require us to deliberate about naming a specific behavior, outlining the impact of the behavior, and sharing big picture of why the impact matters. Example, hold a special meeting or award ceremony to celebrate those people in your group with service award anniversaries. 6 is the authentic leadership. It's the management style in which leaders are genuine, self-aware, and transparent. Leaders means leading by example. Example of authentic leadership. If you are a leader, then you ask your team to come meetings on time and prepared. You should do as well. That's all. Thank you.
Okay, so firstly, thank you, Loarni and Jenevi. Good morning, ma'am, and good morning, class. Myself, Kinjal, and now we are going to move forward with the objective 8.2, which is benefits of interprofessional collaboration. So, collaboration in healthcare is beneficial for healthcare providers, families, and patients, volunteers, organization, and community. I hope that you all are familiar with these words, but I just want to clear one thing, that who are volunteers? So, volunteer is the person who supports hospital in a multiple ways, such as sorting emails, sending flowers to the patient, spending time with the patient, fundraising, and so on. In short, they do a lot of work just to make healthcare providers to focus on patients' treatment. So firstly, we are going to talk about that how interprofessional collaboration is beneficial for the healthcare professional. So first benefit is the role clarity. A team filled with the members who know their individual roles, put personal egos aside, and feel appreciated will increase the likelihood of team success and individual job satisfaction. If you are working in a team collaboratively, you will definitely clarify that what job or what role is yours, what you have to do. Just for example, on the day one when ma'am asked us to do presentation, we distributed the contents with each other, and on that day only I was clarified that what I have to do in this presentation. That so this is what the collaboration leads to the role clarity, that if you are working collaboratively, you will communicate well with each other and will know and will clarify that what you have to do, just to avoid the overlapping of the work. Second one is trust and confidence. Trust, one of the most important elements of a successful team, and trust is very difficult to gain. Of course, it takes days, months, and even years to gain anyone's trust, but and yet easy to lose. It takes only a moment to lose your trust in a person. So that's why it is called to be an important element of the successful team. Third one is encourage the exchange of expertise. Interprofessional collaboration will encourage the staff members to share their existing knowledge with each other. If you are working in a team collaboratively, you will not afraid to communicate with each other, and even you will not afraid to ask someone's help and just to clarify your confusions. For example, when I was doing my internship, there I was posted in a ICU, and there was a nurse who was new in the hospital, and she was finding issues in operating ventilators because the machinery was different in the hospital where she used to do previously. So the team was very collaborative, so she just asked the supervisor just to make her understand that how to operate the ventilator. So instead of criticizing her, the supervisor also showed her that how to operate ventilator here. So next is other benefits of interprofessional collaboration for healthcare providers. So in that, first is no communication gap. Yes, so if you are working collaborative with each other, you will not find issues in communicating with each other, and it will avoid communication gaps. Second thing is conflict management. It is obvious that you are working in a team, you will find a lot of conflicts, but just the thing is that if you are a good cooperative team, you will find it easier to resolve it and to find solution for it. Third one is patient centered care. So if you are happy with each other, you are not fighting, you are not having any other issues in the work environment, it will be easier for you to just to focus on your patients. That's it. Next one is healthy work environment. Again, if you are happy with each other and not fighting with each other, and doing your job effectively, you will find your work environment very healthy. Next one is better outcomes. Ultimately, if you are following these things, if your work environment is healthy, if you are doing patient centered care, if you are doing effective conflict management, there are no communication in between you and your other teammates, it will ultimately it will provide a better outcomes for an organization. And last one is avoid burnout. Burnout is a state state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. So, in your work environment, if you are good with each other, you are humble with each other, you are respecting each other, it is easier for you to avoid your burnout at the workplace. So, thank you guys for listening to me, and the rest of the presentation will be done by Mohammad and Jagdeep. Thank you.
Good morning, everyone. Let's start talking about benefits of interprofessional collaboration in healthcare and how it helps patients and their families and volunteers. Collaboration in healthcare has been shown to improve patient outcomes such as reducing adverse drug reactions, decreasing morbidity and mortality rates, and optimizing medication dosages, and also reducing the ability to have any medical errors. The patient and the families are the most who experience the maximum benefits of the interprofessional collaboration in healthcare settings. So, in this picture, we may explain our aims as a healthy medical team by providing the best patient experience, guided by maintaining strong teamwork and communications to provide a high quality of healthcare services and to secure patients' safety. Interprofessional collaboration between healthcare providers will directly reflect on the faster treatment and easy recovery for the patient without any medical errors. In addition to that, collaboration may improve the coordination and communication between healthcare professionals that will reflect on the improvement of the quality and the safety of the patient's care. So, as a conclusion, interprofessional collaboration is essential in improving patient healthcare outcomes and safety through better communication between healthcare professionals, better teamwork, and better care coordination. Now let's talk more about the importance of having interprofessional collaboration between volunteers in the hospitals. So volunteers may increase the ability to provide a better range of healthcare services to the patients and their families, and also they may help to reduce staff burnout in any healthcare settings. If there is an interprofessional collaboration between healthcare providers and departments, it will maintain a better communication between the teams, and it will be easy for volunteers to get any information about their patients. So when volunteers work smoothly together with the patients and the families by assisting the healthcare providers, this will lead to have a good and better quality of healthcare services for the patients and better support for their families. And this is another important benefit for the volunteers when they are working in a healthcare settings that secure interprofessional collaboration.
Hello everyone, my name is Jagdeep Singh Dhaliwal. I'm Group 1 and today I'm going to explain a couple of benefits of interpersonal collaboration. First of all, for an organization, interprofessional collaboration will increase the job satisfaction and ultimately it will lead to a successful organization. How it will work? By reducing inefficiencies and healthcare costs. Interprofessional collaboration in healthcare helps to prevent medication errors, improve the patient experience, and deliver better patient outcomes, all of which can reduce healthcare costs. It also helps hospitals save money by showing a workflow and operational efficiencies. For instance, in one hospital, interprofessional collaboration significantly improved surgical start time and prevented delays that led to 700 wasted hours over the previous 4 years. Interprofessional collaboration will help in reducing silos and will encourage staff members to discuss before doing anything when needed. Now, interprofessional communication and its credibility in uniting a team is an important skill for organizations to encourage in today's virtual work environment. Employees have already learned uh, and will continue to learn how to use effective communication through both verbal and visual observation during remote conversation. Virtual team environments have brought collaboration to organizations. As employees observe their peers more closely in order to determine cues for entering or exiting a discussion or meeting. Observation and the power of listening are also helpful with virtual body language interpretation. Building collaboration complements the observation that are occurring with all members of a team, and it helps team members decipher the silence. Supporting all forms of interpersonal communication allow employees to exchange information verbally and through the written online platform within the organization. There are some other benefits of interprofessional collaboration for an organization. First of all, its success. It will lead to a good reputation and obviously accreditation. Another benefit of the interprofessional collaboration is for the community. A patient journey represents the various events and activities that a patient has to navigate within a typical healthcare system. It starts with an appointment, scheduling all the way to tests, diagnose, eventual treatment and follow-ups. Each event within the patient journey requires continued collaboration between involved parties like healthcare staff, patients, families, community, and a cured patient. A healthy healthcare provides will ultimately serve a healthy community. The solution for many hospitals is to provide and create the right environment that will foster collaboration and encourage healthcare professionals to join their efforts to streamline the patient's journey and improve decision making and the quality of care. To achieve this, many entities of the healthcare ecosystem started to restructure their teams, taking into consideration collaboration, best practice, and framework, and deploying specialized tools within the potential to support their such initiatives. And that's all for today, guys. Thank you so much. Thank you, ma'am. Thank you, everyone.